For an innominate rotation where the half of the pelvis is rotated forward or backwards relative to the sacrum and or the lumbar spine and the hip, which can cause one leg to appear longer than the other one, you can either use the hip flexors or you can use the gluteus maximus muscle to basically cause a torque about that joint for it to be corrected. So if the pelvis over here is rotated forward due to a tight quadriceps or iliacus being tight with how that connects to everything where it's kind of being jarred forward or torqued forward, the gluteus maximus muscle, which connects back through here, we can use it to basically pull it back, and vice versa. If the gluteus maximus muscle is, we'll say, working too hard or something happened where someone fell and this bone got rotated backwards, we can use the hip flexors to basically cause this to move as well forward. So what we're going to be doing for if they have an anterior innominate rotation where the pelvic bone is rotated forward is we're going to bring their leg up into flexion about where the SI joint wants to start to move, and we're going to have them then engage their glutes to try to extend the hip a little bit. We're going to do about 3 to 5 pushes for about 3 to 5 seconds each, and then we would reassess leg length, positioning in standing or supine to basically see how effective it was. If you do it maybe 2 sets of 3 to 5 repetitions and you're not seeing a change, there's going to be a better way to go about doing it, whether you're doing a muscle energy technique directly for the sacrum of the SI joint or some other problem around that area. So I'm going to palpate with my fingertips on my left hand her SI joint on her right side, which we'll say is the dysfunctional side. And I'm going to flex her hip, and right about here, I'm starting to feel just a subtle amount of motion at the SI joint. Now, I can either put my hip or body against the bottom of her foot. That'll probably cue her to use her glutes. Or what's easier, I think, is to put my hand in her popliteal space or the back of her knee and have her push there. Now, it is very important for you to tell your patient not to apply more than several pounds of pressure, otherwise you'll go flying across the room. And really, you just need them to activate these muscles in this joint position that's almost locked up. So I usually tell people to just kind of push into me with 1 pound of pressure. So go ahead, push down, good. And now in this position, good, relax. She pushed a little bit more with her hamstrings and her glutes, and I was using my hand in the back of her knee for contact. So this time I'm going to do it with her foot on my hip, and go ahead, push down again. A little bit less than that, good. And after about 3 to 5 seconds, we have her relax again, and I flex her up. I'm waiting to feel that barrier where the SI joint starts to want to move again, and go ahead and press down, relax. And I keep flexing her hip up until I just feel that SI joint start to move. And you should feel it be able to go a little bit further each time when you do it. Now, so that's for the innominate rotation by using the glutes. Now we're going to do it the opposite way. So if she has a posterior innominate rotation where we're trying to use the hip flexors, again, I'm going to palpate her SI joint. And I'm going to lift her leg up until where I feel it start to move, right about here. And for me, I'm going to put my leg on the table to support her lower leg in this position as I use just 2 fingers on the top of her knee and have her try to flex her hip or pull her knee towards her shoulder. Good. And she's going to hold that again for about 3 to 5 seconds. She's going to relax. Good. I'm going to move her up a little bit further if I can. And then we're going to repeat that. Relax. And again, After any of these techniques, after you do one set, you want to reassess to see if the patient is improving in pain, in alignment, or if there's another technique that's going to be more beneficial.